Good day, Mom and Sir. I am Anilin Obuhawe, and today I will be performing a return demonstration of starting and discontinuing intravenous infusion. So, intravenous therapy is the aseptic installation of fluids, electrolytes, nutrients, and medications through a needle into a vein. So, the purposes of this procedure is to administer fluids and chemical substances when circumstances prevent the patient from consuming a normal diet and oral liquids. Also, it is to replace fluids and chemical substances when the patient experiences their loss through diarrhea, bleeding, or vomiting. And another is to provide an access to the circulatory system if it becomes necessary to administer emergency medications. And lastly is to maintain access to the circulatory system for the intermittent administration of scheduled medications. The first thing we need to do is to check the IV solution and the medication additives with the physician's order. And to do that, we will compare with what is written in the medicine ticket and what is written in the medical order sheet. So this is to ensure that the patient receives a correct IV solution and medication as ordered by the physician. Next is we will wash our hands to deter the spread of the microorganisms. So let's assume that I already washed my hands. Next is we will gather all the equipment and check the labels and the expiration date. So having all the equipment will save time, and checking the label and the expiration date will ensure safety and correctness. So the needed equipment in starting intravenous in infusion is the IV tray. So IV tray contains the IV fluid. So check the right of the name, the right dose, and the expiration date. Then the infusion set. So we will check the specification. So my infusion set here is my macro set. Next is my the IV cannula. So ang IV cannula has a pink valve. So which means it is gauge gauge 20, and then the plasters, the scissor, an improvised tourniquet, and the cotton ball soaked in a alcohol, medication ticket, and the IV label, and also have in the kidney basin. So supposedly we should have an IV pole, but since we lack resources, I will just have an improvised IV pole or IV stand. And now we will start opening our fluid by pulling the cap of the bag. So as you can see, it has a cap. So we will pull this one. And while pulling, we should maintain aseptic technique since this package is considered sterile and also to prevent contamination of the IV solution. So we'll discard this one in the kidney basin. And next, we will open the infusion set. And in opening, make sure that it will not dangle and we should not touch the tips as to maintain sterility. So next, we should make sure that our clamp is closed before inserting it into the fluid. So now, we will uncap the spike and insert it into the guided hole in the rubber part of our fluid. So make sure that we place our fluid in a flat surface, and in inserting, we could turn it and push it and turn it side by side to maneuver. Okay, so now we're done inserting. So we will now suspend our IV solution and hook it into the IV pole. So now we will gently press the drip chamber to allow fluid and allow it to be filled with fluid at least halfway. After that is we will remove the cap of the end of the tubing and allow the fluid to flow, and we will remove all the bubbles. So in doing that, we will make use of our kidney basin to allow the fluid to flow. And then after doing this, we will close the clamp and recap the end of the tubing to maintain the sterility of the setup. So we were now done preparing our IV solution. So we will now notify the physician or the nurse who will insert the IV. And then if he or she arrives, we will bring the preparation to the bedside to facilitate accomplishment of the task. We'll now identify the patient and explain the procedure since explanation allies patient's anxiety. So may buntag ma'am, ako dahil si Anilin Buhawi, sa ka-student nurse. So pwede mamutano sa iyong pangalan ma'am?
Ako dahil si Angel Dalaya.
Sige po, i-check na po yung ID1 ma'am ha? Okay, sige ma'am. So karon ma'am, magtaod mig imong dextrose ma'am. So medyo sakit na siya sa pag-insert sa anong dagom, pero mura na siya amigas ma'am no? Okay, sige ma'am. So after explaining the procedure, we will now place the patient or assist the patient in supine position or in a faller's position since they will permit the arm to be used and a good body alignment. So ma'am, higda lang pa dali ma'am. So after placing the patient in a supine position, we will suspend the IV solution in the IV pole. So as a student nurse, we will be the one to prepare beforehand the plasters, and before the insertion of the IV cannula, the student nurses will be the one handing the tourniquet to the doctor or the nurses, and followed by the cotton ball with alcohol, and then the IV cannula. And also, while the doctor or the nurse is inserting the IV cannula, we will observe to anticipate the needs of the doctor or the nurse. Assuming that I am the nurse, so I will be performing the IV cannula insertion. But for return demonstration purposes, I will not literally insert the IV cannula, but instead I will just place the IV cannula at the top of the hand of our patient. Ma'am, asay mo ba yun nga kamot, ma'am?
Dari.
Sige, diri ko magtaod, ma'am, ha? Taod na ko, ma'am, ha? So we will release the tourniquet once that we have observed a backflow, and then connect the tubings. So we will start the flow of the solution promptly by releasing the clamp on the tubing. And then after that, we will observe the site for any signs of infiltration. Then we will secure the needle using a plaster. and loop the tubings near the site to prevent the movement of the tubings, and that will cause the needle to be removed. So we will anchor the arm of the patient to an arm board if necessary. So this is especially for pediatric patients. So this is to protect the arm against change in position. Then we will complete the IV label. So we'll put the name of the patient, the IV tip, and the time started, and the date, and the signature. Then we will tape it at the back of the IV solution. So we will regulate the IVF according to drops per minute. So after computing the flow rate and placing the IVF label to the IVF, so we will regulate by placing our watch close to the chamber or the microset or macroset, and we will match the drops to our watch. And that's it. Now we're done with insertion of the IV cannula. So we will now do our aftercare and wash our hands to deter the spread of microorganism, and document the procedure and the patient response. Then chart the time, the site, the device used, solution, and the flow rate, and also the physician or the nurse who inserted the needle. So this is to provide accurate documentation and ensures continuity of care. And lastly is we will monitor the IV solution of the patient for at least every 30 minutes to check the flow rate and for to observe for any infiltration and other untoward symptoms. So when the patient no longer needs IV fluid, IV medication, or access for emergency drug, the cannula is removed. However, a special precaution must be followed when removing the IV cannula because there is always almost a slight amount of bleeding occurs. So first, we need to check the physician's order for discontinuing the IVF. So make sure that we have the medication ticket that has the doctor's order that says we can now remove the IV line. So this is to prevent inadvertently removing the IVF and having to reinsert it. So next is we will wash our hands and assemble the equipment. So assuming that I already washed my hands and assembled the equipment, and then identify the patient and explain the procedure. So assuming again that I already identified and explained the procedure. Then we will now proceed with the procedure. With the use of the cotton ball with alcohol, we will apply it over the patient's plaster so that it will not stick to the patient's skin and to make it easier to remove. We will now release the uncorkage of the arm, the tubing, and the needle. So make sure when removing the plaster, there will be no hair that will be attached to the plaster. Ingon lang ma'am ha, og sakit na naman. So before removing the needle, we need to clamp the infusion tubings to prevent the fluid from flowing out to the needle on the patient or on the bed. And then we will apply a cotton ball or place a cotton ball in the before removing the needle. Ma'am, magtanggal na ko, ma'am, ha?
Sige.
So, and when losing the plaster in the IV site, so we will apply a pressure to the needle and then apply the cotton ball and remove the plaster. Then we will quickly remove the needle. After removing, so we will hold the patient's hand and apply pressure to it for about 2 to 3 minutes until the bleeding stops. So while holding, so we will check the needle or the cannula to make sure that it is intact, and if a broken needle is observed, so we will immediately report it in the nurse in charge. So after that, we will now apply a cotton ball or a band-aid. So we're done with removing, so we will now discard all the supplies we have used and wash our hands to deter the spread of the microorganisms. And then we will record the amount of fluid infused on the I and O sheet and in the chart if necessary. So it should include the amount of the type of solution used, time and reason for discontinuing the IVF, and the patient's response. So that would be all. Thank you.